Health and Illinois Emergency Management Agency Director, Brigadier General Alicia Tate Nadeau. I want to start with a reminder that we have our COVID-19 state hotline number that people should know about now, available in English and Spanish, and Polish and Mandarin will be up by the end of the week. To help answer any questions that people may have, I want to remind you of what that number is, and I would ask you to publicize that if you would. The number is 800-889-3931. My administration created this hotline for the same reason that we launched these daily public updates. It's our priority to communicate with you regularly, responsibly, and honestly. These sacrifices are difficult for all of us, and to get through it, our residents deserve to be equipped with the most clear and reliable information that they can get. I know there are rumors flying around on federal and state action, and I encourage the press and the public to function with a heightened commitment to truth and verification in this unprecedented situation. Here in Illinois, you will be able to get all the facts directly from me and my administration at this daily press conference. Last night, the CDC announced its strictest national recommendations to date, advising against gatherings of 50 people or more for the next 8 weeks. There is new guidance out just moments ago from the President of the United States, and we can talk more about that in the questions and answers. But as a result of the guidance that's been given, I am mandating that any gatherings of the 50 people or more guidance by the CDC will be canceled. Illinoisans who can stay home should continue to do so. It is imperative that our residents take responsibility for themselves, their families, and their communities at this moment. As you know, at 9 p.m. tonight, all bars and restaurants across the state of Illinois will close their dining rooms to the public through the end of this month. This was a difficult decision, but it's what the medical experts and the scientists tell us that we must do to safeguard the health of the people of Illinois. My administration is working with restaurant associations and owners and food delivery services to find options to safely keep kitchens open for drive-through, for curbside pickup and delivery during this period. I know that there are Illinoisans all across the state who get their paychecks from bars and restaurants. My administration has expanded unemployment insurance to cover individuals without access to paid sick leave or who are unable to work due to COVID-19. I have also directed my administration to do everything in our power to provide assistance to every resident who needs it, including seeking a moratorium on utility shutoffs for residents who can't pay their bills during this period, and filing a federal waiver to expand Medicaid. Today also marks another hiatus that's an important part of our effort to curb the rates of COVID-19 spread. This is the last day of school for our K-12 schools across the state until March 31st. We must protect our children and their parents, as well as the educators, administrators, and staff people who work at our schools. And since each of them can also be a carrier of COVID-19 back home if they become infected in school, we needed to stop people from bringing the virus home with them. Yesterday, members of my staff and the Illinois State Board of Education held 6 hours of tele-town halls with our 852 superintendents from across the state to answer questions and work through any remaining challenges. I want to thank our superintendents who have worked very closely with us in designing the best approach in their communities, many of them working around the clock with our team at ISB to meet the needs of the children, parents, teachers, and administrators throughout our state. We'll continue to distribute meals to all children who qualify for free and reduced lunch through a combination of delivery and parent pickup meal options, depending on the district. We're also encouraging schools to expand their meal distribution program to all children under 18 years old, or to any student enrolled in an Illinois school, regardless of their age. Here in Springfield, District 186 is offering bagged breakfast and lunch for pickup from 8:30 a.m. to 10 a.m. at 4 locations across the district: Lanphier High School, Southeast High School, Springfield High School, and Franklin Middle School, with more sites and delivery methods to come. A week ago today, I formally declared a state emergency, activating the State Emergency Operations Center, which is where we are today. The SEOC includes decision makers from every state agency and acts as the coordination center for crisis management response and operations to notify, activate, deploy, and employ state resources in response to any threat. I want to express my sincerest gratitude to the many unsung heroes who keep this operation moving 24/7, the vast majority of whom the public will never know. Springfield is also home to one of our 3 state-run COVID-19 testing labs, which are also located in Chicago and Carbondale. These facilities and their personnel deliver us some of the fastest results of any state when it comes to COVID-19 testing, and support our Sentinel surveillance operation to monitor for the virus all across Illinois. 15 hospitals statewide are running the program, with more to come. 3 hospitals here in central Illinois, 7 hospitals in Cook County, 3 hospitals in other areas of northern Illinois, and 2 hospitals in southern Illinois, all performing this Sentinel surveillance. Together, our state lab and hospital partners are ramping up testing to the levels necessary for us to better understand the presence and patterns of the spread of the virus in Illinois. But to get a full picture of that, we need the federal government to lead, follow, or get out of the way. From the beginning, I've been pressing the White House for a rapid increase in test deployment nationwide. There are COVID-19 tests available right now that have been approved for use in Europe and use in Asia that are not available in the United States. So I'm calling on the FDA to review and approve these tests as soon as possible. Precious time has been lost because the White House made some bad decisions early on, which led to the current low levels of testing across the United States. But at the state level, we've had to scramble to create more testing capability on our own. Our hospitals and our research centers in Illinois, which are some of the finest in the world, were finally given permission by the federal government to develop